and you all might get a pop-up that mentions that. All right. So on behalf of the BC Brain Wellness Program, I would like to welcome you to the workshop, Hiring a Paid Caregiver, Everything You Did Not Know But Need to Know. And our speaker today is Stephanie Chan. I met Stephanie about 5 years ago with my brain wellness hat on and in connection to the work that she does. And I've definitely sent a few people her way that could benefit from her expertise in the services that she provides in her own business called Home to Home. Her full bio is on the website, and I think Martina is going to pop it into the chat as well. But having been in the business for over 17 years and having worked with many people as they navigate hiring paid caregivers, I just thought she's going to be an excellent source of information for us, things that you might use today or things that you might store for the future. And so welcome, Stephanie, and thank you for coming today.
Thanks for having me. I'm excited to do this talk.
I'm going to hand it over to you.
Okay. Hi, everyone. Thanks for coming. Martina's going to help me canvas for questions throughout the presentation. So if you do have a question, put it in the chat and we'll try to answer it at the time it comes up. I'm going to share my screen and we'll dive right in. I will talk a little bit more about myself and my services at the end, but I don't want to delay the actual presentation any further. So let me just share. And can everyone see the slides? Can someone say just yes?
Yeah.
Okay, great. Okay, so as Elaine mentioned, we're talking about hiring a caregiver. And that includes, first of all, stepping back, where do you find them? What are the different sources to find home care support in the public system and the private pay system? How do you look for a great one? Because I think that's the challenge is consistency and reliability and nurturing a relationship so that ideally they feel like a part of the family over time. So we're going to talk about all of that today and more. I'm going to start by stepping back and talk about all the elements that I view as being part of an elder care plan and how home care fits into that structure. And then we'll dive in and talk about all the different ways to find home care and what the differences are specifically between the different sources. And I'll highlight the public system and also the different ways that you can find private pay caregivers. In many of those cases, you actually have a choice as to which caregiver you would like to select or hire. And so I'll go into a little bit of coaching on what interview questions to ask if you're interviewing a caregiver, what qualities to look for, what kind of background and things to look for in the interview so that you can have some confidence you're choosing someone that is a good fit for you. And then we're going to move on to a mix of various topics around, okay, how do you prepare for home care? What are the things you should do in advance to prepare for someone coming into your home and helping you with certain tasks? What does it mean to be an employer if you're going to hire someone directly? It's not as daunting as it seems. So I just want to kind of debunk that myth. And I'll also weigh the pros and cons between hiring a caregiver directly and going through an agency. And also, lastly, we'll sum up with how to build a really great trusting relationship with that caregiver. So when I think about elder care planning, and I do seminars on elder care planning just itself, I do an hour-long presentation on these 5 topics, but I want to just bring up this diagram because home care is really about keeping your living environment safe and the person healthy and safe within the living environment that is your current home. The other elements around, care budgeting, um, getting your financial and legal affairs in order, having a power of attorney in place, and then addressing family caregiver needs. These 5 topics are what I view as kind of the interwoven elements of a holistic elder care plan. But home care, I view, is really about keeping the person healthy and safe in their current living environment. So when each of you consider your loved one's current home, one of the big questions that I see families going through is the question of how do you know when to get home care? As someone goes through kind of the normal, typical aging continuum, generally speaking, you'll see two scenarios arise. One scenario is that everything seems to be fine. There's no kind of big um, event, um, but everything is just going fine. Um, but certain things are getting a little bit harder around the house. And so in this scenario, the warning signs might be hard to spot because they're happening day to day and very gradually. So we're talking about some of the warning signs here. The other scenario is that there is a triggering event. So everything is fine until something happens, and that could be loss of a spouse, a big fall, surgery, a medical diagnosis, something requiring hospitalization, but something that is an unexpected event that triggers maybe the conversation around home care. So for those that experience this, what I call a triggering event, um, it's useful to talk to experts and advisors around that time, and that could be senior living advisors like myself, doctors, people at the hospital, the medical team, physio and OT, around what kind of support does that person need after that incident. So I encourage everyone to consider home care after a hospitalization or a major health incident. But let's go back to the other scenario where everything just seems to be going fine. Um, the warning signs that sometimes pop up, but they're hard to spot because they're happening so gradually, would be mobility challenges. So this is where maybe the person is mobilizing just a little bit slower around the house. The stairs are getting a little bit harder to maneuver. Fall risk becomes a concern. So look for mobility challenges. The next one I want to raise is someone's mental and emotional state. And this may arise due to shrinking social circles. So you might notice the person is going out less often. Isolation can trigger mental health issues. And we now know isolation is tied to other, it raises the possibility of other health concerns. And so isolation, reduced social circles, difficulty in getting out of the house because maybe they stopped driving. Those are all warning signs that maybe it's time for home care. Next, cognitive function and memory decline. And so lapses in short-term memory, forgetting where things are, or maybe more serious, forgetting how to do things that the person has always known how to do, such as play an instrument, cook their favorite recipe. So there's a whole range of warning signs around memory and cognitive function that could indicate that it's a good idea to maybe get some companion care. Maybe the chores are getting more burdensome. It's harder to keep the home tidy. The first task that most people start requesting help with is housekeeping and cleaning. And so that would be definitely a warning sign if you notice that it's harder to keep the home clean. The home seems less tidy. It's harder to do the vacuuming and the dusting, and it's becoming a strain also on the body. Next, activities of daily living. And this would be kind of the daily tasks that one does, particularly tied to hygiene. So showering, toileting, bathing, the morning routine and the evening routine around getting up and going to bed, getting dressed and undressed. So are those things getting a little bit harder? Maybe forgetting to take medications. And lastly, a big warning sign is, and we see this all the time, usually when someone starts needing help, the family caregiver steps in. And in many cases, it's the spousal caregiver because they're living together and it seems the most natural. And sometimes it could be the adult child. And as the person's needs increase, the family caregiver does more and more, and then they start getting burnt out. And so look for signs of burnout. I know that there's sessions um, that are offered just on self-care. I do one as well, but there's a lot to be said about managing self-care, making sure that you don't burn out because you're no good to the care recipient if you yourself are burnt out. And so if you spot the red flags early, I would recommend making small changes gradually. The best way to introduce home care is through a gradual increase. So start small, maybe with house cleaning, and gradually increase as the needs increase. Most seniors do want to remain in their homes for as long as possible. We know this for sure. And many of you on this call probably would agree. And so home care is the natural thing to start with because it involves the least amount of change when compared to downsizing to a smaller home or moving into a retirement community. So home care, because in many cases you can schedule home care and you can structure it any way that you'd like, it allows you to stay in your home for longer, stay right where you are in your neighborhood, so you can be close to all the things that you're used to, your pharmacy, your bank, your doctor. You can keep your routine. Maybe you could like going to the community center twice a week. It allows the spouses to stay together if one is at a higher care level than the other. And in many cases, it is cheaper than moving into a retirement community or assisted living community. In the private pay side of home care, it can be very, very flexible. And so you can design home care services to be whatever you want. So I'll go into that a little bit later as to what private pay home care can help you with. And in the case where you do have a spousal caregiver doing most of the things, going back to this topic of self-care, it's important for them to get breaks. And so home care can be used as respite for that primary caregiver. So they can get out for 4 hours and have lunch with their friends or go shopping or go to the gym or do whatever they want for themselves. So where to find home care? So I'm going to cover 4 major ways to find home care. And I'll also talk about the various costs associated with each. So the first being the most casual way to find home care is if you know someone who has a caregiver that to recommend to you. Word of mouth is often the best way to find any service if you are getting that recommendation from someone you trust. So we'll go into word of mouth a little bit more in the next slide. There's home care services from the public health system. There's the next two are private pay home care services. So you can go through a home care agency, or you can go through another kind of intermediary that is a little bit more of a modern method that's popping up in the last 5 years or so. One of my businesses is one of these where it's kind of like a hybrid between a placement agency and a home care agency where you can find caregivers to hire directly, but it's in kind of like a structured way. So word of mouth. Word of mouth can be from any number of people as long as you trust them. So family members who have had caregivers, maybe you have a cousin, a sister, a brother who have had caregivers in their own family, in-laws, and can recommend that caregiver. Friends, co-workers or ex-co-workers, caregiver support groups are also an excellent way to learn from your peers. And you can learn a number of things, tips, how to deal with certain behaviors, but also caregiving and caregivers, social circles. So, social circles could include church groups, book clubs, private clubs. Think about where you go out and you meet people. And word of mouth is the most casual, and I would say the least expensive, other than the public system, the least expensive way to find a private pay caregiver. So if you do find someone through word of mouth, a really good rate right now, if you're hiring a caregiver directly, is I would say 25 to 28 an hour is a very good rate. There's outliers. There's people who will ask for more and people willing to work for less. But that 25 to 28 dollar an hour range is the sweet spot right now for a really good rate. And 28 correlates with what healthcare aides are making in long-term care. And I'm a big proponent of home care workers getting paid equivalent to what their peers make in other settings. Um, okay, next, the public system. So the public system is the cheapest way to find home care services. It's often what most people start with because I think naturally when we need help, we think of the health authority, we think of the government services, we've paid our taxes, we know that there's public home care services available. And so the natural thing is to inquire, okay, what does Vancouver Coastal Health or Fraser Health provide? So both health authorities in the Greater Vancouver area do provide a level of home and community support. The way to access public home care is through the local healthcare unit in your neighborhood and ask for a case manager to come do an assessment. That might take a couple of weeks, but a case manager will come. I really recommend that a family caregiver, family member be there, be present for that assessment. But that assessment is going to give the case manager an idea of how is this person doing in the home? What do they need help with? Um, and they will also ask for your loved one's tax return for the last completed year. They have a formula that calculates based on the income how much each person will pay for that subsidized home care through, say, Vancouver Coastal Health. So after that assessment, if the person is deemed eligible for certain services, then the home care is set into motion. But the focus is really limited. So the health authorities really are focused on helping people with the activities of daily living and medications. And to some extent, heating up a meal if someone is needing help with lunch, but they don't cook from scratch. They don't do housekeeping. They don't take your parent to or your spouse to appointments, do errands. They don't walk the dog. So nothing around kind of the home support. It's really focused on personal care. The most common thing that I hear clients who have some public home support is that it's too limited. The thing that is frustrating about public home care is that normally in the aging continuum, I have found with clients that the first thing people need help with are house chores, laundry, housekeeping, meal prep. Very few people go from not needing care at all to suddenly needing help with a shower. And so often you have to start with private pay services if you're looking to just start with some, a home cleaning once a week or twice a week. Um, so the scope is limited and it's inflexible. So I'll tell you a couple of anecdotes. I have a client right now who gets help with 2 showers a week. So if your loved one needs help with showering, um, they don't get help every day. So if you're accustomed to showering every day, that's a bit of a problem for the public home care system because they will do 1 or 2 showers a week. I have a client looking for a third shower a week, and I'm getting pushback from the case manager on adding a third shower. He goes for walks every day, so he gets a little bit sweaty and than most people, but and I'm getting pushback on that. I have another client going through some pushback from their case manager um, from Fraser Health. Her dad is diabetic, and Fraser Health is saying they'll no longer do insulin shots. And so the scope of what they will help with changes and is dependent heavily on their workforce and whether they have a shortage of workers to provide the services. The other piece of feedback that is really common is that you never know who might show up and that it could be a different person. So there's no guarantee with the public system that it's the same person each time, which could be really disruptive to the person, opening the door, the care recipient, to see a different person. They come by public transportation a lot of times, and so um, sometimes there's a domino effect. If they're late for one appointment, then it makes them late for all the appointments, and so often they don't come on time. So as I mentioned, they're really focused on the activities of daily living. Where public home care could be good is if your loved one really only needs help with singular tasks. So if they only need help with medications, it's actually perfect because the public home care worker will come, witness and administer the medication and leave. And so that visit might be 15 minutes. And a 15-minute visit would be virtually impossible to find a private caregiver to come for that short of a time frame. So where the public system works well is if your loved one has a task that they need help with and it takes under an hour, then the public system actually works well because it would be very hard to get a private caregiver to come for such a short time frame. So for private pay care, how it differs, whether you're hiring a caregiver directly or going through an agency, it's fairly easy to set up. And so it's quicker than going through, waiting for an assessment, meeting with the case manager, waiting for Fraser Health or Vancouver Coastal Health to implement service. But you do pay more. And so the range for private care, if you hired someone directly, I mentioned that 25 to 28 dollar an hour time frame. If you go through an agency, that range can go all the way up to 50 an hour these days. So it depends on where you're finding that private home care. But one of the benefits is that you have a lot more control and visibility to design what it is that your loved one needs help with, what time you want the caregiver to come, what days you want them to come. And also there's a wider range of services and types of assistance that they can help with. So my next slide will go into that a bit more. And as I mentioned, you can go through a home care agency or you can hire directly. So I mentioned that the range of tasks is a lot wider with private home care. So you can get them to help with any housekeeping chores, whether it's mopping the floor, vacuuming, cleaning the windows, doing laundry, taking the garbage out, anything to do with housekeeping. Some caregivers love cooking and they're great cooks. So your loved one can get a home cooked meal and they'll serve it right before dinner. So healthy meal prep is a real benefit of private home care. Of course, they can also handle medication reminders. For those that are experiencing isolation or with those that have cognitive decline and where the spousal caregiver maybe needs to go out and they don't want their spouse to be home alone, a caregiver can provide companionship to keep that person safe, but to also do things with them to keep them mentally stimulated. They can help with any activities of daily living, so all the hygiene tasks that I've mentioned before. They can help take care of pets, cat or dog, walk the dog, feed the dog. They can help with errands, so help someone with grocery shopping, going to the pharmacy to pick up the meds, taking to appointments. So a lot of caregivers can drive or accompany someone in a taxi or Uber. For those that need transfer assistance, so those are in wheelchairs, most caregivers who are registered care aides will know how to use a lift. I'll talk about registered care aides in a moment when I get to, what to look for in a caregiver. And Alzheimer's and dementia is going to be one of the biggest issues facing older adults in these next coming decade. And so dementia care is becoming a more and more common request by clients, and families want to keep their loved ones who have cognitive decline or dementia at home. And so a caregiver can help with dementia care. Lots of caregivers have experience with dementia care as well, and with some of the tactics around dementia care. Um, so that's really common. Okay, so you'll get a copy of this presentation, but I came up with this chart just to summarize the pros and cons around the different ways to find a caregiver. With the public health system, the main advantage is, I would say, the cost. And so with hiring a caregiver privately, the cost is higher, but the main advantage is the flexibility, the control, and having a wider range of assistance available. And so between a care agency and hiring a caregiver directly, it's really around what kind of intermediary do you want in the middle? So with the care agency, the agency employs the caregiver and they assign the caregiver to you. They charge a lot more than hiring it directly. And so it can get expensive if you need a lot of care or as that care need increases. The caregivers will earn less than when you hire them directly, and you don't necessarily get to pick your caregiver when you go through a care agency. If someone's not working out, you can request that they assign someone else, that you don't get to interview and pick that caregiver from the outset. When you hire a caregiver directly through word of mouth or through another platform, that caregiver will earn more. And I think that's important because they're more motivated and it will support longevity in that relationship. You'll often pay less than what you would pay an agency. You get to interview and choose the person you want. But if you do hire a caregiver directly, there is a little bit more work involved in managing that caregiver, being an employer to that caregiver, which I will go into in a minute. And if that caregiver is sick or goes on vacation, um, you'll need some support in finding coverage for that person. Okay, so those are some pros and cons around the different options. So let's say that you are looking at hiring a caregiver and you have found them through some means and you are interviewing candidates. So here are my top 10 things that I would suggest you look for. And these are the things we look for when we bring on caregivers and match them to clients. So first of all is, do they have good experience in senior care, either in a long-term care setting or in home care? So I always look at experience. So that's common sense. Have they done anything other than home care? So sometimes their background is very interesting. And I look for things like, okay, were they a nurse in their home country? We have so many immigrants in the home care sector. I would say 80% of the workforce in home care are probably ethnic. And so I look for what they used to do and before they came to Canada. Qualifications. So there's a designation in the home care sector that's different in each province, but every province has a professional designation program. In BC, people go through a care healthcare assistant or healthcare aid program that's available through the community colleges. It's roughly a 9-month program that involves a practicum in a real life work setting, like assisted living or long-term care facility. And they become registered care aides. So that's the terminology. In Ontario, for example, the terminology is PSW, a personal support worker, and that's the official designation. So it's slightly different in each province, but that is a qualification that you want to look for if the tasks that you're asking the caregiver to do involves a lot of personal care, so incontinence care, help with showers, medications. We often look for someone who is a registered care aide. Now, having said that, there's a lot of home care tasks where being a registered care aide may not be as important. So, in cases where maybe all you need is cleaning or cooking, there's lots of great companions and home care workers that maybe don't have that formal designation, but lots of experience to um, maybe counteract that. And they could be great cleaners and great cooks, great companions. So in addition to looking for the qualification, one thing I always say is I look for a great attitude. And I actually think that's just as important as these 10 things. Next, what is the rate of pay that they're expecting to earn? So you want to talk about whoever you're interviewing, an agency or a caregiver, make sure that their expectations are within budget. If your loved one has a specific condition such as Huntington's, Parkinson's, Alzheimer's, dementia, we look for people who have experience with those conditions and can spot the behaviors and the symptoms that are associated with that condition. Where are they coming from when they are, if they are hired and they're coming for the shifts, where are they coming from? Um, it's always nicer to have someone who has a short commute. Um, I find that while people are happy to commute, say 45 minutes to an hour or more, that it increases the probability that something's going to go wrong with the traffic, with the weather. And so when we do matches with caregivers and clients, we always look for someone who's within a half-hour commute. So ask, when you do interview, ask them, how long is their commute? Are they okay with the commute? Where else do they work? So if you're only looking for part-time help, chances are the person that you're going to hire has another part-time job. And so talking to them about where else they work and what their availability is will enable you to ascertain whether they can fit in your ideal times into their schedule. And so how flexible are they to increase shifts? If you want to start with 3-hour shifts or 4-hour shifts, do they have the flexibility to increase that if things go well, to go stay for 5 to 6 hours or to add additional days to the week? Always do job references. So ask them for people that they have worked for, either private clients, a supervisor in the home care agency that they've worked for, or a supervisor in a senior's residence that they've worked for. So always ask for references. We call and email the references, and we ask certain questions just to get a sense of, in that person's own words, what was the person like in their job performance? Were they reliable? What were their best attributes? What could they improve on? Is something I always ask in a job reference. If you were to pick something that they could improve on, what would that be? And then we always do criminal background checks. Many caregivers have one ready to go because they've been asked for it by other interviewers. And so often they will have one ready to show you. So preparing for home care. So let's say you've thought about these choices, you're ready to move ahead. One of the things before we get into the various things to prepare for home care, um, often when I talk to particularly the adult children of a parent who they're trying to convince to get home care, resistance is the first thing that they face. And it's like, I really want my mom or dad to get some help, and here's why I'm noticing these things. Um, but the resistance is like the first wall you hit. And so I just want to mention a couple of things about those of you who might be facing resistance around home care, because compared to other options, it is the path of least resistance. However, the thought and the decision around allowing a home care worker into the home is still a big one for a lot of people. Um, and so I really recommend, this is why I recommend to start small with baby steps. A cleaning service is often seen as less intrusive and more beneficial than, helping with a shower. Like helping with a shower is a big step. And it's a very personal task. So start with something very impersonal, whether it's grocery delivery, cleaning, um, you know, transportation. Those things are often seen as less intimidating. And also remind your loved one that there's no long-term contracts, no long-term commitments. It's just to try it out. And if you really don't like it, we can go back to the way things were. Um, you're not committing long-term to anything. So this is just to try it out to see if you like it and could benefit from it. So if any of you want to talk about resistance more, just message me after the talk today. But it is often the most um, challenging first step. But let's say you get past the resistance and you're ready to move forward. The first step in preparing for home care is coming up with a care plan of some sort so that the caregiver knows what to do when they start. So think about what it is that your loved one needs help with. What are the tasks that they have the biggest challenge with? So that could be cleaning or laundry. That could be showering or the morning routine. That's really common. It could be, mom is okay with breakfast and lunch, but I really would like her to have a really hot dinner because that's the main meal of the day. So might be cooking dinner. So when you think about the tasks that they need help with, what will come naturally out of that is, okay, these are the times of the day that we could really benefit from having some help. Also, when there's a family caregiver involved, such as an adult child or a spouse, it can be difficult to really discern in your mind what is it that I would feel comfortable in delegating to someone versus I can do everything myself. Because I think it's really easy, especially for spousal caregivers, to just do everything themselves because they live there and it's easy. Um, and it might seem easier to do it yourself than to teach someone how to do something. But that spousal caregiver, we need to make sure that they don't burn out. And so I really encourage people to get comfortable with delegating tasks to either a caregiver or asking for help from other family members or friends, anyone that you can build into your support team. So in this care plan, when you think about the task and the schedule, what will come out of there is, okay, does this equate to a part-time job for someone, a full-time, or a live-in? And that is really a function of um, whether the person needs help with scheduled activities or unscheduled activities. So for scheduled activities such as, okay, mom really just needs help in the morning getting up, and she has morning medications, and then she's actually good the rest of the day, or vice versa. Scheduled care is conducive to getting someone in part-time. Full-time would probably be ideal if someone needs help throughout the day with going to the bathroom, walking around the house. Maybe they have cognitive decline and can't be on their own. A live-in is appropriate where someone needs round-the-clock care. And so that person really shouldn't be alone even at night, overnight. Maybe they're getting up, or maybe the family just doesn't want them to be alone in the house overnight. And so a live-in is actually more cost effective than paying for 2 12-hour shifts. So there's different ways to structure private pay home care. Okay, so back to, the things to do to get ready for home care. Supplies. If you're hiring someone to cook and clean, is your fridge stocked with the ingredients? Do you have your cleaning supplies stocked up for the caregiver to use to clean the house? And as you think about the schedule and the kind of care you need, do pay attention to what your loved one needs during the night. Overnight care is often the thing that really adds to the cost. And so if you're finding that you need overnight care, consider a live-in. Um, but also for the overnight care, think about whether the caregiver can sleep because you only need them to get up for emergency situations or whether you need them to stay awake. Um, and so an evening caregiver who stays awake um, is paid differently than a caregiver who can have a sleeping shift. Okay, staying on the topic of preparing for home care, there are certain things that would be really helpful to the caregiver for you to write down in advance. So the first is your loved one's daily routine, just so the caregiver can get a sense of, okay, what time does this person get up? What do they like eating for breakfast? What do they like eating for lunch? Um, do they like to shower in the morning or at night or in the afternoon? What are their hobbies? So what activities could I do with them that they enjoy? So routine, hobbies, preferences. What do they like eating? Do they have any allergies? I would recommend putting an emergency contact list on the fridge so that they know who the next of kin is, who to call in the case of an emergency. What health condition does your loved one have? That would be important for the caregiver to know. If there's more than one caregiver, and we help clients with this, assemble a care team. So it would be useful for everyone to have some visibility on, so there could be like a weekly calendar on the fridge to show, okay, who's showing up Monday at 9, Tuesday at 9, Tuesday at 5. And so they can see the various shifts and how they fit into the whole team. There should be somewhere for the caregivers to record hours and write observations so that there is a record of these professional home care services. And as I mentioned with the care plan really could be simply a list of tasks that the caregiver does, so they know what to do on a shift. And so those tasks could be daily, weekly, or some could be random. And lastly, consider workers' comp registration when you have a caregiver in the home on a regular basis. Somebody should be registered for WorkSafe, and it could be you as the homeowner or the employer, or it could be the caregiver. Workers can register themselves for WorkSafe. If you do hire someone as a caregiver directly, there are some responsibilities of being an employer. So I went through some of the benefits. Caregiver earns more, you have more visibility, control, you pay less than through an agency, and you get to nurture that relationship directly with the caregiver. But the responsibilities are payroll every 2 weeks. And so, and you can get help for this. There are people who, including me, who will help with payroll. But this involves making that calculation every 2 weeks on what the gross pay is, the deductions, remitting to Revenue Canada, issuing pay stubs, and then at the end of the year, T4s. So every pay period, there's remittances for tax, EI, and CPP. And as an employer, the employer also contributes EI and CPP. I generally tell people to budget about 10% of gross pay for these extras. Workers' comp, I just mentioned. There's also vacation pay. So as an employer, just like any other job that all of us have had, there's vacation pay. And there's a couple of different ways to do vacation. You can accrue it. So the minimum vacation is 4% of gross pay. And of course, you can be more generous if you'd like. But you can accrue it, and then it gets paid out when they take the vacation, or you can pay it out on each paycheck. And in that case, if you pay it out on each paycheck, then when the person takes vacation, it's unpaid. Under employment laws, they're entitled to a certain number of sick leave days that are paid. So these are the main responsibilities. And so it's important to keep good documentation, be very organized. And again, don't be intimidated by any of this. There are lots of people who can help with the employer-related responsibilities. Thought it would be helpful to go through a sample calculation between going through an agency and hiring someone directly. And this is just, I put arbitrary numbers in here. And so definitely there's some flexibility in these numbers, but for this example of hiring someone full-time, 40 hours a week, at $28 an hour, and again, it could be higher, it could be a little bit lower, but at 28, your weekly pay, gross pay is 1,120. From there, the caregiver would get a net amount because there's taxes and CPP and EI taken off of that. But then the employer would contribute roughly $62 and $25 respectively for CPP and EI. Then there's a vacation pay or accrual for a total of $1,253 per week. So that's the employer amount to budget. Through an agency, and again, I picked this $45 number. You can find agencies that are a little bit lower. You can find agencies that are a little bit higher. But $45 an hour, you're paying $1,800, and then there's simply just GST on that. So it's $1,890 per week. So you can see the differences. Now, I would suggest that it's not simply, the decision is not simply financial when you think about the other pros and cons that I went through. But a lot of people do consider finances as one of the primary factors in weighing the different options of whether to go private or through an agency. Ways to build a relationship with a caregiver. So regardless of how you found the caregiver, whether you've hired directly or through an agency, you now have this person in your home and you want to foster a really great relationship with that person because they're taking care of your loved one. And it goes both ways. So I think it's important for you to trust them and for them to trust you as well. So I really encourage really open communication with that caregiver. And a simple thank you goes a really long way. I can't say that enough. That I think is the most understated thing is just thank your caregiver. Have them know that you appreciate them. A lot of the caregivers, when they get frustrated with the job, because caregiving can be very hard, I think that some of their frustration some of the time is that they just feel underappreciated. But that appreciation can make their day. Provide feedback, but also ask for feedback. So if the caregiver's been working with your loved one for a while, ask them for, how are things going? What are your observations about mom or dad? Is there something that we can do to make the home safer? Is there something we can do to make your job easier? What are some of the things you're having trouble with? What are you noticing about mom or dad that's changing? And if there's something I can do to make your job easier, tell me. Again, that goes a long way in this kind of making them feel appreciated, and that knowing that you value their opinions. Try not to micromanage if possible. We had a caregiver who got really frustrated with the husband. So the care recipient was the wife, and the husband, who was the primary caregiver, was telling the caregiver how to load the dishwasher, that she wasn't loading the dishwasher the way he likes the dishwasher loaded. And so she was really frustrated with that. That's just a little anecdote, but um, provide feedback, but there's a balance with letting them do their jobs. And then lastly, common sense, but you would be surprised, pay them on time. If you're paying the caregiver and you're supposed to pay every 2 weeks, pay them on time. And again, it's just respect and appreciation for that caregiver. Often with the primary caregiver being a spouse or even an adult child, the home care service provides a valuable function of respite so that the primary family caregiver doesn't get burnt out. So for that primary caregiver, I mentioned this before, don't be scared to delegate. It is very important to share the care, take breaks, and it is absolutely okay to set boundaries and say no once in a while. Um, I think most family caregivers put themselves last, and we say yes to everything. It is okay to set boundaries, and you don't need to feel guilty about it. It is okay to hire someone to help with the tasks. You don't need to feel like you need to do everything. One other thing as a family caregiver you can do to help yourself is to educate yourself about the resources that are out there, services that maybe you don't need now, but could be important later down the road, and educate yourself about your loved one's condition so you know what to expect as that condition evolves, so that you can make informed decisions rather than being in a panic when something happens. So, in summary, being proactive in the home really is around accepting home help is the best way to remain independent. It seems a little counterintuitive, but you need to accept a little bit of help to remain independent in your home. It'll allow you to achieve the lifestyle goals and stay in that home for as long as possible. And having a bigger support team actually will really be helpful as care needs arise and as unexpected things happen. And really, all we want to do is maintain that higher quality of life for as long as possible and delay the need to move to long-term care. So in terms of how we can help, I have a couple of businesses that help seniors with a range of things. One is a platform that helps families find, match, and manage caregivers, where you hire them directly, but we recruit and we vet them for you, and we help with things like scheduling, finding vacation fill-ins, and all that. And as well as payroll and payment processing. So I'd be happy to talk to anyone about that and do a home care assessment to see if home care is right for your loved one. My second business, which has been around for 17 years, helps people with healthcare navigation and healthcare advocacy. For those that have made a decision to move, we actually have a whole downsizing team as well. And so I'm happy to provide, in either case, a complimentary consultation to answer any questions you may have, not necessarily about home care, about Vancouver Coastal Health, what services are out there, what are seniors' residences like, and how much are they? So any questions you have, if I can answer within half an hour, I will. So my contact information is here. Feel free to contact me anytime. Elaine will send a copy of this to the group so that you have this for your reference later. And that concludes the presentation. And I'm going to pause for discussion. And I have some questions for you. I want to get some feedback on what the challenges are you are all finding. with family caregiving, and I want to see if you have any questions for me.
Before we close off the screen and go to the larger group, I just want to say thank you very much, Stephanie, for your time and for your expertise and the incredibly easy to understand and not so easy to understand topics. So with much appreciation for that. So I just want to thank you for that.
You're very welcome.
And I'm going to stop the recording.